Families flee political uncertainty in the U.S., find haven in Nova Scotia's healthcare system. In a move that's both heart-wrenching and hopeful, American nurse practitioners have relocated to Nova Scotia, Canada, citing political unrest and a misalignment of values in their home country. But here's where it gets even more compelling. This exodus wasn't just a personal decision. It was strategically facilitated by Nova Scotia Health's targeted recruitment drive, launched immediately after the 2024 U.S. presidential election. And this is the part most people miss. The province's proactive approach included an immigration team that streamlined the process, making it a big draw for professionals like Colleen Conway-Edwards and Patrick Finn. Conway-Edwards, a geriatric nurse practitioner, left Tennessee with her wife and 6 children, settling in Bridgewater. She describes her family as very other. Married to a woman and raising children with profound special needs. We were feeling unsafe in the States with the current administration, she shared. Canada felt like a place that aligned more with our values of education, healthcare, and safety. Finn, formerly of North Carolina, echoed similar sentiments. The policy changes in the U.S. didn't reflect our family's priorities, he explained. Now working as a primary care provider in Bridgewater, Finn appreciates the autonomy he enjoys in Nova Scotia's healthcare system. A stark contrast to his supervised role back home. Here, I'm able to practice to my full potential, he noted. Nova Scotia Health's Director of Recruitment and Volunteer Services, Laura O'Brien, revealed that their large-scale marketing campaign was intentionally timed to attract professionals feeling displaced by political shifts. We wanted to welcome them here, she said. The effort has paid off, with 4 nurse practitioners already on board and 5 more in the hiring process. But here's the controversial part. Is this migration a one-time reaction to political turmoil, or does it signal a broader trend of healthcare professionals seeking stability and alignment with their values abroad? And what does this mean for the U.S. healthcare system, which is already grappling with workforce challenges? For Conway-Edwards and Finn, Nova Scotia isn't just a new workplace, it's a new home. I feel very lucky, Conway-Edwards said, adding that many friends and family back in the U.S. wish they could make the same move. Finn, meanwhile, is excited to be part of a healthcare system in transition, addressing community needs with a sense of independence he never experienced before. As these families settle into their new lives, one question lingers. Will more professionals follow suit, and how will this shift impact healthcare on both sides of the border? Share your thoughts in the comments. We'd love to hear your perspective on this complex and emotionally charged issue.